So ClinicaMind, at its very core, we're trying to make healthcare more human again. Ironically, through AI, imagine. There's a lot of physician burnout. So a lot of it has to do with the workflows that they have, with the immense amount of work that they have to do at home after they leave the hospital. At the fundamental level, we're just trying to make their lives a lot easier so that they can go and do much better patient care, which is what they got into healthcare for.
Okay. Our workup revealed a brain tumor. Would you like to dive into the specifics of its history, medications, imaging, or labs?
Yeah, let's.
What we saw in the car demo is he leaves UCSF after a long shift, and he's talking to Epic, which is this very complex system, all powered by Apollo GraphQL and Apollo MCP server. And he's basically reviewing, as if he was speaking with a highly experienced colleague, the cases that he went through. They're discussing what medicines might be good for this person with a brain tumor. You know, what's the latest research before we do surgery tomorrow? It's tapping the clinical studies databases, which was processing thousands of studies in milliseconds, extracting the right things that Julio would want to know about, and having a really deep medical conversation with him. So data in healthcare is fragmented, and it's very hard to build systems that can communicate with each other, which, as you can imagine, limits what we can create in healthcare. And that's what Apollo helps us with. So, Apollo GraphQL server, with all the built-in best practices, with the fact that we can, out of the box, have great level of control of our data. And with AI, it makes it even easier. Now with all the MCP tooling that's been released, it's phenomenal. And why it helps us so much is that we're able to iterate really quickly and learn fast, right? So if I was to summarize it, it's that ability to take a concept, prove it or disprove it really, really rapidly. In healthcare, you should learn fast. You need to iterate very fast and learn and perfect it, because there is no MVP in healthcare. You're dealing with patient data, you're dealing with highly private data, highly sensitive information. And at the end of the day, it's someone's health, someone's life, someone's well-being, right? So you have to be very, very adamant about having high quality systems. So Apollo was just a no-brainer, and both the team, the customer support, the community was a massive driver, and obviously the product, which is phenomenal. And I think it's really exciting because I think Apollo is really aligning itself to be an AI-first platform, to be kind of the go-to standard, not just for APIs that are consumed by software, but by agents. And that's huge. AI is such a phenomenal tool to enable humans to be able to do way more.